Home versus in-center, hemodialysis, what the evidence says, 2024 Cochrane Review. Hi everyone, welcome back to the channel. Today we're diving into one of the most important questions in kidney care. Should people with kidney failure receive hemodialysis at home or in a dialysis center? To answer this, we're looking at the 2024 Cochrane Review titled Home versus In-Center Hemodialysis, what the evidence says. When your kidneys can no longer filter your blood, you face a life-altering diagnosis: end-stage kidney disease. This condition presents patients and their families with a critical, complex decision about life-sustaining treatment. The primary options for hemodialysis, a procedure that cleans your blood, are performing it at home or receiving it in a specialized medical center. Each path carries profound implications for daily life, independence, and overall well-being. To navigate this choice with confidence, we turn to the highest level of medical evidence. This brings us to a landmark Cochrane Review titled Home versus In-Center Hemodialysis for People with Kidney Failure. This comprehensive review was authored by a global team of experts: Melissa S. Cheatham, Isabel Ethier, Rathika Krishnasamy, Yongji Cho, Swetonia C. Palmer, David W. Johnson, Jonathan C. Craig, Paul Strumza, Luke Franson, Jorgen Hegbrandt, and Giovanni F. M. Stripoli. Cochrane reviews are considered the gold standard in evidence-based practice, so this is the best place to look for unbiased, high-quality answers. They achieve this by systematically gathering all relevant studies on a topic and rigorously analyzing them to minimize bias and produce a single, reliable summary. This process ensures that decisions are based on the complete body of evidence, not just a single study. Section 1. Why this question matters. Kidney failure affects millions of people worldwide, and hemodialysis is a life-sustaining therapy. But the setting of dialysis, home or in-center, can dramatically influence quality of life, independence, health outcomes, cost, and caregiver burden. Understanding the evidence helps clinicians, patients, and families make informed decisions rooted in evidence-based practice. Section 2. What the review looked. The authors systematically searched for randomized controlled trials comparing home hemodialysis versus in-center hemodialysis. They evaluated outcomes such as mortality, hospitalization, quality of life, treatment complications, vascular access issues, and patient satisfaction. This approach ensures decisions are based on rigorous, unbiased evidence, not assumptions or tradition. Section 3. What the evidence shows. So, what does the research tell us when comparing home and in-center hemodialysis? Here's the key takeaway. There is limited high-certainty evidence directly comparing home and in-center hemodialysis. This is largely because conducting large-scale, long-term randomized controlled trials for these treatments is ethically and logistically complex. However, by analyzing the available observational studies and smaller trials, a consistent picture begins to emerge. The available data suggest potential benefits of home hemodialysis, greater flexibility and control over treatment schedules. This means patients can integrate dialysis into their lives, rather than structuring their lives around dialysis. Imagine fitting treatments around work, family commitments, or simply when you feel most energetic. Possible improvements in quality of life. By eliminating travel and waiting times, and receiving treatment in a familiar environment, many patients report feeling less like a patient and more in control. This often translates to better sleep, improved energy levels, and a more positive outlook. Ability to perform more frequent or longer sessions, which may improve symptoms. This gentler dialysis can lead to better blood pressure control, reduced post-dialysis fatigue, and fewer dietary restrictions. Increased patient autonomy and empowerment. Successfully managing one's own treatment can be a powerful confidence booster. Potential challenges requires comprehensive training, dedicated space, and significant home modifications and equipment. This initial setup can feel daunting, may increase caregiver burden. While many care partners are willing, the responsibility can be physically and emotionally demanding. Not suitable for all patients due to medical, social, or home environment factors. Issues like unstable housing, lack of a suitable care partner, or certain medical complexities can make it unfeasible. In-center hemodialysis. On the other hand, in-center treatment provides direct professional supervision. Medical staff are immediately available to manage any complications, from a drop in blood pressure to access issues. There is no need for home setup, storage of supplies, or plumbing modifications. The responsibility for the machine and environment rests entirely with the clinic. This may be preferred by patients who feel safer in a clinical environment or who do not wish to take on the responsibility of self-care. But it can also mean less flexibility in your daily life, more travel time, which can be exhausting and costly, and more rigid scheduling, with fixed appointments 3 times a week that can disrupt work, family, and social life. Section 4. What this means for evidence-based practice. Evidence-based practice integrates best available evidence, clinical expertise, patient values, and preferences. Because the evidence is limited, shared decision-making becomes even more important. Clinicians should discuss lifestyle needs, medical suitability, home environment, support systems, patient goals. This ensures the chosen dialysis modality aligns with what matters most to the patient. Section 5. The author's contribution. The review team highlights the urgent need for more high-quality trials. Their work reinforces that policy decisions and clinical recommendations must be grounded in evidence, not assumptions. Outro. So, after weighing all the evidence, what is the ultimate bottom line? The choice between home and in-center hemodialysis isn't a simple one. Home therapy clearly offers greater flexibility and can significantly improve quality of life for the right patient. However, it demands a substantial commitment to training, a reliable support system at home, and meticulous adherence to safety protocols. The current body of evidence, while promising for home dialysis, is still growing, and we await more long-term studies to definitively compare outcomes. This is why the decision must be deeply personal and collaborative. It's about having an open conversation with your healthcare team, weighing your lifestyle, your values, and your comfort level with the responsibilities involved. If this detailed analysis helped you understand the nuances, please support the channel by hitting the like button and subscribing for more evidence-based breakdowns. We want to hear from you. Have you or a loved one navigated this choice? Share your experience in the comments below. Your insights can help our entire community. Thanks for watching. Remember, knowledge is the first step to empowerment. Stay informed and take charge of your health journey.